Hi, everyone. My name is Giza Lopez, and I am the Executive Director of the New York State Youth Justice Institute. Let me start by welcoming each of you to our Lunch and Learn webinar series. We appreciate that you're making time to learn more about youth justice research. Please feel free to introduce yourself in the chat. I want to express my thanks to all our partners in New York State, and especially to the Division of Criminal Justice Services and UAlbany. Without their institutional support, we wouldn't be here. I'm excited to share with all of you a new tool developed by YJI. It is a curated collection of different data and resources related to important dimensions that affect our young people's success and well-being. Somebody's going to put it in chat shortly, and it is titled Youth in New York State, a Snapshot. We hope that you will make use of it and let us know your feedback. I hope also that each of you had a chance to relax and celebrate Juneteenth yesterday. To help YJI mark Pride Month and raise awareness about the needs of our LGBTQ+ youth, it is my pleasure to be the first to welcome today's speakers, Dr. Ashley Austin and Dr. Shelley Craig. Thank you both so much for joining us today and for making time for this webinar. We appreciate you. Without any more delays, let's get started by welcoming today's facilitator, Dr. Alicia May. Alicia, the virtual floor is yours. Thank you.
Great. Thank you, Giza, and welcome everybody to our YJI Lunch and Learn series. My name is Alicia May, and I am the YJI's Research and Evaluation Specialist. So it is my pleasure to introduce our speakers, Dr. Ashley Austin and Dr. Shelley Craig. Dr. Austin is a professor of social work at Barry University. Her research and expertise revolves primarily around developing practice-based knowledge to promote the health and well-being of LGBTQ+ children, teens, and adults. Her clinical practice approaches are rooted in an affirmative framework that honors sexual and gender diversity across the lifespan. Dr. Craig is a full professor at the Factor Inwatash Faculty of Social Welfare at the University of Toronto and Canada Research Chair in Sexual and Gender Minority Youth. Her program of research, based on 25 years of community and clinical practice, is focused on developing affirmative programs and clinical interventions to cultivate the resilience of sexual and gender minority youth, explore the role of digital technologies on youth mental health, and develop competencies in social work. Together, they are the co-developers of the AFFIRM Interventions for youth, adults, caregivers, and professionals, and have conducted trainings both nationally and internationally. We're excited for them to lead today's discussion on AFFIRM Caregiver, which is a program designed to support people caring for LGBTQ+ youth. So without further ado, Ashley, Shelley, the floor is yours.
Thank you so much, Alicia. Welcome, everybody. I'll go ahead and try to share my screen with you all. All right, it's happening. That's always a good sign. I'm trying to make sure I can get slideshow on here. Just not making it easy for me. There we go. It's happening. All right, now we can welcome you. So you are here at AFFIRM Caregiver. We're really excited to share with you a little bit about our interventions and our program of work. So I'm going to kick it off and Shelley will take over in a little bit. So what we're sharing with you today is going to be a focus on AFFIRM Caregiver, but a caregiver is sort of part of our suite of affirmative interventions for LGBT young people and their families. It's rooted in evidence, and we'll sort of spend a little bit of time talking about the evidence base up front, and then a little bit more later specific to AFFIRM Youth. And we'll go ahead and have you take a little poll for us now, just so we can get a sense of who's with us today. We're really excited to be presenting to folks associated with youth justice. We don't always get to do that. All right, getting a little sense of who's in the room. Okay. Yeah, so this looks a lot like what we're used to seeing is a lot of folks sort of in the middle, some early to the work, and a couple folks who've maybe been doing this for a while. And we like to sort of, we have to give you questions. We have to give questions, right? Like the idea of beginning, intermediate, advanced, but we know it's really sort of a spectrum, right? And so we're all sort of continuing to learn, us included. So really happy to have all of you at all of your levels of knowledge. Hopefully you'll learn a little something more today that'll spur you on to learn a lot more later. So we're focusing on Caregiver, which came out of our AFFIRM Youth work, which we for Shelley has sort of been a lifelong labor of love. I joined her a long time ago now, maybe getting close to I don't know, 13, 14, 15 years. And we developed AFFIRM Youth together, which is a manualized intervention. It's 8 sessions. It's rooted in CBT, and it has a host of evidence behind it. Shelley's been doing lots of randomized clinical trials up in Canada, so we are a sort of international partnership. We've been doing a lot of the work between the US and Canada for the last, well over a decade. And so we were really excited to just recently be recognized as the only LGBT youth intervention that is listed in the California Evidence-Based Clearinghouse for Child Welfare as an evidence-based intervention. We are really excited about that. It's something that we've worked really hard for. By we, I'm saying mostly the Canadian version of we have worked really hard on to sort of build this evidence, and it's a promising intervention, and we're really excited to now do a lot of the dissemination of that work and have it implemented across the US and Canada and other places. So that was sort of the initial work, and then AFFIRM Caregiver came out of our work with AFFIRM Youth. So we'll talk a little bit about that for the rest of the day, but I want to give you a sense of what AFFIRM Youth is really about. It's a CBT intervention aimed at addressing coping skills among LGBT young people and adults. And it has sort of all the aims that you would imagine we would want for LGBT young people. We want to build coping skills, build hope, help them deal with coping with unique stressors, and address some of the mental health concerns. And this is an infographic looking at the way it has reduced depression, but some of our more recent data that is under review, will be published soon, looks at the ways in which it also has positively changed anxiety and suicidality. So this is really exciting work that we've been doing for a long time with really strong results. AFFIRM Caregiver came out of sort of the idea that we really wanted to do. Our first work was to meet youth, especially youth who did not have caregivers who were willing to participate. So we wanted to make sure that young people had the coping skills they needed to work with whatever their environments were giving them. And so that was really important for us. And so we wanted to be able to sort of build on that with the caregivers that were interested in becoming more affirming. So we had a range of requests from different folks asking us to build the caregiver version. So the caregiver version came out of the youth work. It's not a CBT model, though it has some principles around changing the way we think and act. It's a 7-session manualized intervention. It is evidence informed. It can and is delivered virtually and in person. It's effective for bio parents as well as grandparents and foster parents, kinship caregivers. It targets lots of different factors that are relevant to the well-being of diverse LGBT folks. Those came directly out of our AFFIRM Youth knowledge base. It's a closed session. All of our groups are closed interventions. So they're really meant, they are not sort of pop in and out. They are meant to be delivered in a closed group format, but can be delivered flexibly so that folks can, have all the sessions, 1 session a week for 7 weeks, or they can bundle them based on what your agency needs. The goal is really about promoting safe, affirming, and compassionate caregiver-child relationships, and doing this in a way that meets the needs of LGBT-specific young people, because they tend to be left out of most parenting interventions. It's rooted in this deep understanding of the science that tells us unequivocally that family acceptance is incredibly important, and rejection by family or loved ones is really, really detrimental to the well-being of LGBT young people. Acknowledges the crucial role of affirmation, connection, support, and hope in the lives of LGBT young people. And it was all of our interventions are developed to counter sort of harmful, unethical approaches that intentionally or unintentionally pathologize, invalidate, or render invisible LGBTQ identities and experiences. This is sort of a little infographic that was developed through our work with the Center of Excellence that sort of gives a snapshot of how this process works, how the AFFIRM caregiver groups work. Caregivers really engage in mutual aid with one another as they are challenging themselves to become more affirming and challenging themselves to sort of feel some of the feelings, understand them better, begin to examine thoughts, feelings, and beliefs that might underlie the way they are feeling about, interacting with, understanding their young people's experiences. And we really focus on building caregiver knowledge and awareness through psychoeducation that is rooted in this really sort of compassionate, meet the caregivers where they are approach. What we've seen through the evidence is that caregivers are able to demonstrate more affirming attitudes, behaviors, and have more confidence in their ability to be affirmative toward their young people. Why is it important for you all to think about this? Well, when we think about sort of some of the LGBT statistics that have driven our work, there's sort of an overrepresentation of health inequities for LGBT populations across the lifespan. And when we look at youth that are in juvenile justice, LGBTQ youth are overrepresented. The percentage of incarcerated LGBT youth is double that of the LGBT population in general. And this is similar to what we see in sort of other foster care settings, homeless youth. Services in these settings, and like in most settings, are not tailored to meet the needs of LGBTQ youth. Youth often get re-traumatized within juvenile justice settings, and the highest risks for these are already marginalized LGBTQ youth of color. And these experiences mimic some of what we've seen in other systems of care, like foster care and other systems. So it's really important to really think about some of these challenges. We've got another poll question for you to think about what you know about the ways in which parental rejection might impact LGBTQ youth well-being. All right, we've got some super informed folks in the room. We're really excited to see this. Sad that this is the answer, but really happy that you're aware of it, because I think it really helps to sort of root this conversation in the severity of the consequences for LGBTQ youth. Yeah, so unfortunately, rejection is associated with anxiety, depression, and suicidality, intent and outcome. And we see this particularly true for LGBTQ youth broadly. And then, of course, the more marginalized identities a youth has, the more we see their risks go up. So thank you for participating in that. And so we've got some of this information here, right? We're sort of looking for representation of queer youth in juvenile justice settings, often related to the fact that LGBTQ youth are discriminated against and rejected in their lives. And so this discrimination and rejection in their homes, in their families, in their communities, in their schools, in their religious institutions lends them to be sometimes homeless, sometimes forced to engage in activities to support themselves that they wouldn't have to be engaged in if they were receiving the support and affirmation from their caregivers, their communities, the sources of support that cis and straight youth can often count on. So we say that see them end up in the system in these various ways. So really important to think about how they enter and how we can ensure that they are not re-traumatized once entering systems, that they're rehabilitated and supported through this work. So what is an affirmative stance, right? So what are we talking about this AFFIRM caregiver? It is much more than the absence of homophobia, biphobia, and transphobia. It's really about engaging with others in an affirmative way that includes sort of deprogramming anti-LGBTQ beliefs that are rooted in stigma, bias, and prejudice, really challenging myths and misconceptions, deprogramming. By that, we mean unlearning myths and misconceptions about what it means to be LGBT, the myths and misconceptions that we've often gotten in lots of places, replacing biased attitudes, beliefs, behaviors with those that actively embrace and validate LGBT identities and experiences, that explicitly reject anti-LGBT discrimination, rejection, and bias, and that really empower LGBTQ individuals to stand up against stigma. So it's really this idea that we're not just sort of passively saying we care about LGBT folks, but we're really working to root services and our understanding of LGBTQ youth experiences in a deep understanding of both stigma and marginalization and how that impacts LGBTQ youth's experiences, sort of builds on the last slides, right? Like really understanding how our queer youth end up represented in systems of care, including juvenile justice systems and foster care systems and in homeless situations. So thinking about that, why is affirmation important, right? Why not regular old CBT? Why not just standard parenting interventions that are good for all kids? Well, what we know is that that it really matters because LGBT interventions that are promoting LGBT-specific acceptance, support, and affirming parenting practices are targeting the unique needs of LGBT youth, and that a lot of what's getting in the way and isn't addressed by your standard interventions are really related to these pieces around affirmation, support, acceptance, and rejection. And so in order to address caregiving, we can't use standard caregiving interventions that don't attend very specifically to the barriers that are sort of this big barrier in between LGBT youth and their parents or caregivers. So it's really, really important. What we want you all to think about today as you're thinking about this idea of affirmative caregiving or affirmation, what is it? It is a spectrum of attitudes, beliefs, and behaviors that are related to the extent to which they validate, honor, and support the identities, lives, and experiences of LGBTQ youth, right? And so it's not all or nothing. It's not yes, no. It's not either or. It is a really wide sort of spectrum with lots and lots and lots of little points on it for any one of us, whether we're affirmative professionals. I think just even right beginning, intermediate, and advanced, there's this wide spectrum of our abilities to be affirmative professionals, even in terms of the knowledge, the experience we have. Same thing for caregivers, right? So they're going to enter at different places, and there's going to be lots of different opportunities for growth and lots of opportunities for them to move forward. So it's not sort of a yes, no. We believe that almost anybody is a really good candidate for these interventions and that they can make progress, even if they start at one really far end of the spectrum, whether it's really, really non-affirming or like nailing it super affirming, like, I don't know, people who deliver these interventions like me, if that I could continue to benefit, and I do, from lots of different things. And so that's the stance we want for a parent, understanding parenting. AFFIRM Caregiver builds parenting skills. It is really about building affirmative parenting skills, the ability to caregive, parent, and support our LGBT youth in our lives. So we are helping them learn to demonstrate an affirming stance, not just hold it, but demonstrate it. Recognize the impact of LGBT-specific sources of stress on the lives of their children, really recognize and acknowledge and understand it, and acknowledge the critical role of their specific support around their kids' queer identities, right? Not everything but this, but inclusive of their child's LGBTQ identity on the well-being of their young people, and really help them better engage their LGBT children from a space of compassion, affirmation, and a really trauma-informed perspective. Here's just a really quick snapshot of what the caregiver intervention looks like. It is, 7 sessions. They all they map onto our youth intervention, and they really cover what we think are the critical components of being able to understand and meet your LGBT child where they are, and the sort of growth opportunities that caregivers need. I'm going to turn it over to Shelley so she can begin to share with you a little bit of our mounting evidence base in this area.
Thanks so much, Ashley. I appreciate it. Go ahead and go to the next slide, and we'll talk a little bit about the evidence. So as Ashley identified, AFFIRM came out of our understanding and our need that to really understand and support caregivers, even if they're not affirming. We are really essentially saying we believe that affirmation is a continuum, right? It's not just affirming and non-affirming. And we believe that most parents and caregivers can move in some ways. And I want to say I understand a little bit about the work that you do because I've done some work in juvenile justice when I was in Florida, and I think it's really challenging work. And of course, you're dealing with very complex familial situations when you have even the opportunities to interact with the majority of the folks that are there. And still, there's even more of a need to be able to, for you all to be able to have some of these conversations and to really think about how could we move caregivers forward. So this data that we have comes from a study that we did specifically in child welfare, which is another group of caregivers that have, are sometimes quite difficult to engage and not necessarily affirming. So we typically do not work with caregivers who are completely affirming, because that would identify, that would sort of mean that we have less to do, right? We all kind of like a challenge. That's why we're all doing the work that we're doing. And so we looked specifically at 2 different counties, and we used our AFFIRM Caregiver 7-session intervention, which Ashley sort of described a little bit about what the components are. And we used a co-facilitation model, which is something that we do tend to strongly advocate within the context of delivering affirmative programming as much as possible. So you could support each other and also help the caregivers move forward in sometimes different ways. So we looked specifically at foster parents and kinship caregivers in Cuyahoga County and Allegheny County, so in Pennsylvania and Ohio, and specifically, again, within their child welfare system. And we had a number of cohorts, and we had 32 in Cuyahoga and 71 in Allegheny County. And we looked sort of at our pre and post test with some key measures because we wanted to understand a bit more about how this was working and potentially what was working so that we can kind of do some scaling up. So, and again, this is sort of our first early pilot study. And it was very helpful, I think, to see the data. So what we saw is the majority of our caregivers that completed pre and post, which is the majority of the folks, which is great, were foster parents. Majority for foster parents with a small number of folks who were kinship caregivers. They had never provided any sort of care for an LGBT young person before they were working, and talking through the AFFIRM Caregiver intervention. So that was really important. It wasn't really something that they necessarily knew that much about. They hadn't provided, most of them had not provided care for a trans person, trans young person before AFFIRM, and most of them identified in some way in some of our more typical categories that we see a lot showing up in particularly the foster parent system, but cis women, folks who identified as straight, white, with some percentage of folks who identify as African American. Go ahead, Ash. And so what we saw in all of our measures in this case that we're reporting were the ones that was statistically significant. So we looked pre, post, and 3-month follow-up to see if the results held. And the results did hold, which is great, which means they learned how to both they learned new skills and they were able to apply those skills even when the group ended. So we look specifically at affirmative caregiving attitudes, behaviors, and self-efficacy. And self-efficacy in this case really means I have the ability to apply what I've learned and to be a more affirmative caregiver. And it's measured through, I think it's like a 15-item measure. And so I have the ability to apply this and apply what I've learned to be a more affirming caregiver. So that's great. And so what we saw also is we saw improvements. Some folks start a little higher than others, but we saw improvements even for the folks who started out higher, they were able to move up, and the ones who started lower were also able to move up. Now, not everybody got to the 10 that we might want, 10 out of 10 of being the most affirming caregiver, but everybody could move. And so that was really helpful. So here's some of the examples from some of the folks that we weren't necessarily sure how much or what the impact would be. And so a foster mom who took her trans daughter clothes shopping, she didn't really even understand before she started AFFIRM Caregiver. What she said was, well, I'm an AFFIRM caregiver. I can actually work these ideas and the different thoughts and different skills and tools and actually use them and apply them with my child, which is one of the things that we strongly suggest with all affirming types of interventions, is the ability for application and trial, in some cases, kind of trial and error. And she said, I used the skills and was like, what do you want to wear? Instead of telling her young person where to go, she said, what do you want to wear? And her face just lit up and she blew right to the section of clothes, the girl section, that she wanted to wear and that she liked. And so that was, in fact, quite a meaningful interaction. Then a grandparent who came in very low, I think maybe a 1 on the affirming spectrum. This program has definitely changed me and helped me be more open and accepting, and knowing that we're all humans and we all deserve to be able to be loved and respected. So that's also very helpful in terms of understanding. Quickly go through a couple of the impacts on caregivers that we found specific to some of our scale-up work. Parents are more ready to now have, once they're engaged in this intervention, new or difficult conversations with their young people, and the caregivers are more emotionally prepared to do so. So they're not avoiding, they're able to engage, they have some skills to be able to even start and continue these conversations. The agencies have shifted. The agencies overall have become more aware of the needs and impacts on LGBT families, and they understand the importance of supporting families with specific and tailored interventions. And facilitators, even as facilitators, when we see the change in our clients, when we see the change in this case in the caregivers, they help really believe, they got more confidence to do the facilitation and help them really believe in AFFIRM and really support each other in ways that they had not before. Go ahead, Ashley. So one of the things that we do have folks think about, and so we talk about this just from the jump when you're talking about like our AFFIRM caregiver interventions, but I think even any sort of LGBT interventions, thinking about organizational readiness. So how ready is my organization to really engage in this work, right? We can't just have 1 or 2 people who want to do this. We have to have an organization and a number of folks that are committed, or else it's just often too much. And many of us have been champions at our organizations and we get that. So organizational readiness for implementation really describes the extent to which an organization is willing and able to implement and then sustain the selected intervention and support the facilitators and support the structure and the clients, even if there are some challenges, as many organizations do experience in this kind of political climate we have now. So here's a little QR code for a readiness assessment that has been created by our dear colleagues at the Center for LGBT Equity and Excellence. Go ahead, Ashley. So how can I, in my last minute, I'm going to say, how can I support effective implementation at my site or LGBT implementation, affirming intervention generally? So you want to educate yourself on the needs of LGBT youth. Many of you have probably done a lot of that in your work, in your professional development. You've come here, which is awesome. And potentially get trained in our interventions or others. There aren't really that many others. It would be great if there were lots. And figure out how to apply them to your organization. Looking specifically at the research, we're really research nerds. We do think the research can be really helpful in guiding the practice. And so as researchers, we think that's important. The idea of advocating or sharing a little bit of what you've learned with stakeholders, political stakeholders, organizational stakeholders, stakeholders in the child's well-being, which can be caregivers, support staff in some way. Go ahead, Ashley. And we do have upcoming, this is just our little, blurb, just in case it would be helpful to you all, but we do have caregiver trainings that we do a few times a year. We have some that are coming up. They're 3 full days, 7.5 hours each day, but fairly intense experiential training. So we're not just talking at you, kind of like we've been doing now. You are in.
Hi, Shelley. I think that you've frozen. So Ashley, if you could.
Okay, I wasn't sure if it was me or her. So Oh, you're back, Shelley, but I'll finish up. You froze randomly this time.
Oh,
So this is just our training that we have. Like Shelley was saying, they're 3 days. Our AFFIRM Youth and our AFFIRM Adult and our AFFIRM Caregiver Interventions are always 3 days. They're virtual. They're 5.5-hour days. This is the one that's coming up the soonest for Caregiver. We have a July one coming up for youth, and we can certainly share more information if you want to learn about all of our trainings or access all of our free research. It is on our website, which is this QR code here. There's our mailing address, email address. And so we are happy to share any of that. And I think we get a great opportunity now to talk with Alicia and share a little bit more information about this through some Q&A.
Yes, great. Thank you so much for the brief overview of your program. If your cameras work, feel free to turn them back on, and if it turns off, we'll deal with it then. So the first question that we have for you, so your AFFIRM Caregiver program, as you said, evolved kind of out of your AFFIRM Youth work. Are there instances where there are parents who are in the AFFIRM Caregiver group while the young people that they are caring for are in the AFFIRM Youth group? And how does that work? And do you have any research that talks about like the supports that happen like when both are receiving the intervention?
Yeah, so that is our ideal version of implementation in the perfect world. So if we can get youth in and parents in, like we said, everybody can learn, even affirming parents. And so in our perfect world, that would happen all the time. It's not a perfect world, but we do have some great examples of when sites have been able to make it happen. And so we've had a couple different sites there. It's happened in Prince George's County, Maryland, during the foster care implementation rollout that Shelley mentioned earlier, with both foster parents and grandparents and kinship parents involved while their young people were also in AFFIRM Youth. We've also had a couple different rollouts in Oklahoma, one of the sites there, in Denver, Colorado, and different settings. Some were community mental health, some were foster care settings, and some were actually gender clinics. And we've heard really, really positive things about this, that there were conversations on car rides home, if they've done it in person, where conversations that had never happened before started, where young people were reporting to their therapist how much they were able to see their parents changing. We have found that this has been really, really beneficial. The data that we have so far is qualitative, and it really speaks to both parties sort of saying we felt closer, we felt more connected, we understood each other better. And this is an area that we are hoping to get to do more research through the implementation science that we're doing, where folks are getting to roll it out. But it's a great question. But I will say this, even when you can't, it is really important to recognize that even when you can't get youth and parents in at the same time, they both work. They're both important. And some of the caregiver work has been done, like Shelley mentioned, with caregivers who have never yet had an LGBT young person in their home, but we know that they will. So preparing them for foster care work with youth later. So we recognize that this can benefit a range of different situations and settings. So just important to think about.
yeah, and I'll say, Alicia, it's like Alicia, you may have read our minds, because we're working on putting out that qualitative data from that study that we did. So that's a big piece to really understand kind of those collaborative processes, but it's also not necessary. Most families are not in that kind of situation, or in which they could do that simultaneously. And that's okay, because we want to make sure that youth have the skills with or without parental or caregiver supervision to be able to have good lives and cultivate hope. And we want caregivers to be, as Ashley said, more affirming, even if they don't necessarily have LGBT young people in their home yet, or they're not sure. So I think it's in parallel, it's great, but also separately, we see interactions. I'll just say one quick story, but we had, I think this was out, this was, I think, out in Oregon. We have a particular site, and we have a number of young people, a number of caregivers who went through the caregiver intervention, right? And we had one of the, and so it wasn't simultaneous, it wasn't concurrent. And we had one of the children of one of the caregivers that went through the intervention that came back and wanted to give a hug to the facilitator because they said, you've really helped my caregivers, right? So that's just qualitative data, qualitative story. This young person wasn't going through the intervention, but still they were able to see the impact. And so it was very, you know, I was obviously crying, like it was a very nice story.
Yeah, that's really sweet. I'm glad to hear that. I can imagine that that type of program really helps with a sense of like safety
Yes.
for youth who are not necessarily out to their caregiver if their caregiver is receiving this. I can imagine that. So you've already talked a little bit about this, but we had a question that came in. So if you have a different thing to share, are there qualitative or anecdotal feedback that you've received from youth whose caregivers completed the AFFIRM Caregiver Intervention? I know that you just gave a story, but I don't know if there's any other like global feedback that either of you could share. I'll pass to Shelley first and then to Ashley.
Sure. Yeah. I mean, the stories that we have are sometimes, what's also interesting is we have sometimes stories from youth themselves or the siblings of youth that might not necessarily identify as queer themselves that are saying, my caregiver is just a little bit more accepting, a little bit less judgmental because they've been through this program. And so that's also interesting. It's coming from a sibling and not necessarily, you know, I don't know that the young person was asked or was part of the other sort of clinical work in which there was a bit of an overlap, but it was also interesting that there's sometimes a little bit of an extension of these compassionate caregiver kind of approaches that we're helping folks leverage and understand from the perspective of LGBT youth and the end impact on LGBT youth, but it also impacts and positively impacts the family or the, you know, the foster family in this case as a whole. And it's not just limited to, not that, I mean, that would be enough, but it's not just limited to the LGBT young person. There's sort of a bit of a different understanding of the impact of our caregiving behaviors and the need for affirmation and support and meeting the young person where they are on the entire system. So I'll just give that quick example and then turn it over to Ashley.
Yeah, it's funny as I'm thinking, you know, we gave the example of the young person who came back and gave the hug and some of these other things. Something that just came to mind, it's sort of off, it's sort of just sort of about the bigger impact. But one of the things I remember from the rollout with Maryland, the Prince George's County site, was these grandparents who were, you know, sort of all the things that you would not imagine would make it easy for them to parent a gender diverse young person. There were struggles, there was a lot going on, and they went through this intervention. And not only were they much better able at supporting the young person, they didn't want the intervention to stop. They kept wanting, they were getting it as like a family. So the facility was going to their house and doing it with grandma and grandpa together. That was their own little group. And they were like, wait, it's over. Like, can't we keep it going? So people who were originally resistant, realizing like this felt good. It felt safe. It felt comfortable. We want to learn more. So I thought that was kind of cute because I think a lot of facilitators, it's a hard thing to facilitate sometimes. And so it's a lot of work for the facilitator. So knowing that these sort of gold nuggets are out there that you get at the end, it sometimes makes it worth it.
Yeah, great. Thank you. That does lead into another question that we have. So we can imagine that there are some specific challenges to implementing the AFFIRM caregiver groups with caregivers who begin at that low end of that spectrum that you talked about in the presentation. Do you have strategies that facilitators can use to successfully engage these caregivers within the groups? If you have a couple of examples that you could share, that would be.
Yeah, so it is challenging. Like this group in some ways is more challenging to facilitate than the LGBT young people. We would always say usually like eager participants, they're like excited to sign up. Caregivers are sometimes, we'll say ambivalent, right? Ambivalent. Like I think a lot of us are ambivalent about doing our own work. And so we would see some ambivalence. So what we often get our facilitators worried about is what about highly religious caregivers, like whose religion doesn't align with, you know, or doesn't seem to align with affirmative practice. And so, you know, or people who are just really sort of really entrenched in their views. And so what we really work with the facilitators on as they're doing this work is to really sort of do two things. Marry two things, which is kind of hard. One is to really sort of meet the caregivers where they are, with compassion, whether or not, right? Like generally, we're not going to share that sort of place. We're usually going to be much further along, hopefully, than some of these stuck caregivers, but meeting them where they are with compassion while simultaneously modeling and advancing this affirmative sort of stance toward LGBT youth. And they do this in a number of ways, but sort of being able to sort of have that as the core, sort of the centering, I guess, stance for all facilitators is really what we help them do. And we help them sort of remember what we said, that all caregivers can change and do change. We've seen it all the time, not necessarily in session one. So sort of this patience. The other thing we often say to facilitators as with caregivers, because they're like, what are you trying to do to me? Or what are you trying to get me to believe? We remind facilitators of little approaches like this, where you invite, group members to sort of, if they would be willing to just sort of grab sort of their views, their beliefs, all of it. They get to keep it all, just put it in a little, I don't know, whatever it is, a little baggie, a little package, a little bucket by the door. They are welcome to pick it all up as soon as the group hour is done. But if they wouldn't mind just sort of putting it to the side by the door for this hour while they engage in a new learning process. So we teach facilitators how to invite participants into this conversation without pushing them further than they're ready to go at this moment, but without sort of feeling too scared to invite them into this conversation. And so facilitators often do a really wonderful job and have really creative ways of meeting the caregivers' needs as they're doing this work.
Yeah, and I'll just add, I think one of the things, and I think facilitators often get nervous, which makes sense, but thinking about what are the points of connection? What do we know that this caregiver might care about, right? And so often they're overall, both the facilitator and the caregivers are concerned about the well-being of the child, right? And so what are the points of connection, even though we have these different perceptions or, different religious stances, whatever it is, what are the points of connection, related to the child's well-being? And my other sort of tip that we talk about a lot is keeping the focus on the child's well-being. It is about the caregivers, but helping the caregivers understand that caregiving or less caregiving behaviors have an impact on the child. How is that impacting your child when you say that? How does your child respond, right? So keeping it focused often on the child or the young person and less about, well, this is my belief, which we understand is important, but we're not saying that's not important, but we're saying, but we get that. And also, how do you think it impacts your child given what your child is going through or what your child is experiencing? So those are a couple of things. Finding those points of connection and keeping it focused on the well-being of the young person is I think are really important, because folks can get a bit lost in that.
Yeah, making it more of a both and rather than either or. Like, you can have both of these. I think that's a really important thing.
Yeah.
We have a question that you may not have anticipated from our audience. So have you trained parents who have children who are currently or have been incarcerated in either adult or juvenile facilities? The person elaborates, having worked in the system, I found it to be a particularly difficult environment for LGBTQ youth.
Yes.
And many did not have parental support either prior to or during their period placed out of home. So do you have any of that experience?
It's a really good question. And so I think that in some tidbits, right? So we've gotten kids who have come through foster care, who have spent time in juvenile justice settings, who are involved in multiple systems, who are doing this work. We do a lot of work in schools with kids who have been in and out of juvenile justice settings. So AFFIRM is in a lot of schools. There's some caregiver work. I think, honestly, the question is so good, and that's why we're so excited is because it's not enough. Absolutely not enough. Have we been able to sort of reach these systems? And I think this is just sort of, sadly, like the bigger picture is that LGBTQ youth who are suffering the most are often the hardest to reach with the affirmative interventions, whether it's affirmative youth or affirmative sort of caregiving practices. So I think that is a great question. I concur. I think we find that a lot of the young people who are in systems of care not only have a lack of parental support, but often other co-occurring traumas that make it really difficult to navigate their own well-being, and who need extra support and are getting sort of less when they need extra. So our, sort of hope is that this will help folks in different systems of care and interfacing with kids and adults in justice settings to do this. The other piece I'll say about adult is that because we do a lot of adult, we have an AFFIRM adult piece. We've been recently launching it. We have a rollout right now where we're partnering with folks who are coming out. Some of them never went in, some are at risk of being incarcerated, some are coming out of incarceration in LA County related to a lot of substance abuse and alcohol and drug abuse related issues and related crimes. So they're sort of accessing it in different phases, and we're seeing it go really well. So we would love a lot more. We agree with the participant that there's such a need, maybe even the highest need. Yeah.
Yeah, and I'll just say very quickly, I completely agree. And I think one of the ways, as folks know, probably folks on this call, I think the staff and the professionals within the context of the system, the juvenile justice system in particular, are so critical, right? So we've been fortunate to work with staff, right? And in some cases, then the staff have had the opportunity to engage somewhat with caregivers to help them shift a bit, right? But as you know from the caregivers themselves, there's so much happening, kind of as you all know, and Ashley has said, it's so complex that the caregivers may not be showing up for much or anything, and they're really not showing up for their LGBT kid in some ways, right? So figuring out a way to kind of all the way through the organization integrate it, right? This is what we're thinking about as staff. This might be something that we just integrate into the way that the organization is starting to think about these issues, right? These are maybe some additional steps we can do to provide safety or safer spaces for LGBT youth in these organizations. And we get the complexity of that, right? But to try to provide like direct support to the young people via the professionals, and also the professionals are sometimes the folks who are facilitating these conversations, even if they're one-on-one with some of the caregivers, at least a little bit. How do you even kind of like introduce it in a way that doesn't necessarily out the kid if the kid isn't out, right? But creates that opportunity for a bit more understanding from caregivers who might already have had a bit of a challenge with their own caregiving, which is related to why the child is maybe even there, right? So that's sort of a long explanation, but I think if there's a lot of complexity there, and we want to say that it's, we do understand that, and we think it is important. And caregivers are harder to get to the table generally, and I do think these caregivers in these situations might be even more difficult. Sometimes it could be mandated. There could be some things that happen, right, as we see sometimes in the child welfare system, but we understand that it's different across each site.
Yeah, and with this, I know that you also have that AFFIRM professional intervention that's like in early-ish stages, is my understanding, and that ties into the next question that we have here. So for programs that are starting and showing promise, what advice do you have for them to get from that point of promise to a point of evidence base, seeing as you've had a couple of programs that you've developed that have achieved that evidence-based status, and you have other spin-offs, if I can say that, that are in that promising category. Do you have advice for people who are providing programs to make that leap?
I'm sorry, are you asking us people who are delivering other LGBT interventions, how do they get?
So broadly, there are programs that go from promising to evidence-based, and that's a big leap for programs to take. And I think that Shelley, when you were talking about the evidence-based portion of the presentation, I think that this might be a question directed to you. And then Ashley, if you have other comments about like the practice portions of it.
Yeah, I would say, so it's a great question, and it's hard. Is it terrible to say that, right? But it is, otherwise there would be lots, right? Because there's lots of great ideas that people have out there, but it is about, I think, a couple of different things. It is about having the research, right? So to move from the the sort of evidence-informed, which is where we are with Caregiver, our sort of next step is a larger rollout with a control group, right? Isolating the impacts, really honing in on what we would see as successes and successful outcomes from the program, which I think we have from all of the early work that we've done in the development work, having a good sense of what we need to and hope to see change as a result of our intervention, building that into the intervention, building that into the measure. So the next sort of level, and it is about, and usually it's about having sites and having some sort of funding to be able to get a very strong and very robust sort of research project that's a clinical trial up and running. And the thing that we found, and this, I can talk a lot about research, so it's kind of annoying, but like the thing that I think is really important though, is that for the work that we've done, it has been, sometimes it's, we get some funding and sometimes we don't get as much, right? So we're trying to support the development of that evidence base, but we need to make sure that our research is solid because of what we are seeing, the kind of attacks that LGBT young people are experiencing, that professionals in the system that are trying to advocate for LGBT folks are experiencing. We want to make sure that what we are providing as tools are very solid and very evidence-based. And so we want it to be as strong and as robust as possible. And so that piece of it, I think sometimes may take a little bit more time in terms of thinking about the scale up, right? And anyway, so that's all I will say is because I think this is a population that continues to be increasingly actually under threat, and the people that support them are as well. We want to make sure that the tools that we're providing are as strong as possible so that it can support these kind of conversations moving forward. So hopefully that makes sense.
Yeah, absolutely. Thank you. Ashley?
Yeah, I think that's just such a complex question because it requires tons of funding and support, and the complexities of the population we're working with don't make it as easy to build an evidence base as it does for other non-marginalized populations. And so I think it's interesting there, there's a lot of conversations through SAMHSA. How do you build an evidence base for under-resourced populations such as the LGBT community, Indigenous populations? And I think part of it is this challenge, right? Like when, I think this is sort of how do you build the evidence base? And while we're still building the evidence base with far fewer resources than other populations, how do we still meet the current needs, right? Like we don't not serve population because we don't have the evidence yet. And I think we see some of this in some of the other ways that science around LGBT and trans-specific healthcare is being attacked, is sort of using the absence of good science or enough science, right, to sort of like withdraw care. We still have to serve LGBT clients and their families with the best available evidence. And that's really what this is. And I think there's a great book through SAMHSA that's free. And I think it's on our website. I know that, a link to it, but it's on SAMHSA's website. It's something like evidence-based interventions for under-resourced populations, something like that.
Developing, something like that.
And it talks about sort of how folks can think about this. We are sort of in that book, AFFIRM is in that book in a little part, but they go through. So that would be maybe a good resource for folks who are looking to build up their own interventions. So.
Absolutely. In our post-webinar materials, we could flag that specifically and link to that. So great. Thank you for sharing that with us. And I think that your response here really leads into this next question that we have. How do the AFFIRM interventions attend to other cultural considerations, for example, intersections of multiple identities?
So I'll start and then I'll pass it to Shelley to talk about some of our more global work. But I'll just say that we've gotten this question from the beginning of time when we do this. So Shelley and I, at our roots, are social workers. So this is something that we, sort of have always thought about, sort of, from our beginning days of as social work students and sort of doing all the work that we do. So we really have always wanted to root it in a multiplicity of sort of identities and experience of any given client. I'll say sort of it's a both and. This is an LGBT specific intervention. So these are interventions aimed at finally centering the needs and experiences of LGBT people, young people, their caregivers, because those are absent everywhere you look. And so it's about centering that and attending to the whole person. So who they are and what they bring. And the work that Shelley and I, like, she lives in Toronto, I live in South Florida. The research that we initiated has started in really diverse communities. And so we've thought about this from our own practice from the ground up, but also in the work that we do with AFFIRM. And I'll let Shelley talk about sort of what it means to attend to different identities when we're doing this work sort of across the globe. So I'll flip it over to Shelley.
Yeah, and I will say, like, some of the things that we've intentionally tried to do, even within the context of our manualized interventions, so caregiver and, youth and adult, are specifically, the content always centers the LGBT identities, but there are lots of prompts and lots of sort of ways for facilitators and clinicians to also integrate the other identities, right? So we want to make sure that we, when we're doing like training or talking about it, are saying, we can't give you a blanket answer because we don't know necessarily who's going to be in the room. Every group will have the same curriculum, but be facilitated maybe a little bit differently because you're wanting to bring in the whole people that are in the room, right? And so those pieces of it are helpful for facilitators to become comfortable with. So whether it's, we're thinking about the implementation that we have, like in Mexico City, for example, right? So what are some of the cultural considerations that are part of that? And then how can the facilitators integrate that into, so how do these different identities that you have align with sort of your idea of what caregiving could be or what parenting could be, right? So it's a lot of prompts to kind of introduce those questions into the room, because sometimes we do see with the range of identities a perception of conflict, right? I'm a religious parent, I'm maybe a racial minority parent, and I also might have this non-binary young person, right? Whatever that is. So how do we as facilitators help them move through some of that conflict and recognize, actually, those are all strengths that can help you become a more aware, affirming caregiver of your all of the needs of your young person, which will also be multiple because they hold a lot of those identities as well. So we've built that in a lot, and we talk about that a lot because we absolutely agree. It's not based on just our own experience. It's based on a lot of experience of a lot of the facilitators. So we consult with them also a lot to kind of integrate that into, this is how we should sort of talk about this with our particular caregivers in this area.
And we think about like the US, the diversity of the US, and like how different, New York State might be from Mississippi, and we've had, sort of AFFIRM in both places. And then we're doing, obviously always a lot of work in Canada and the US, but also, like Shelley mentioned, Mexico City, the Netherlands, it's been translated into Hungarian. We do work in China. So it's sort of like the idea of like Shelley and I would actually have the expertise to talk about those intersections is sort of, no, we really are sort of inviting the facilitators to sort of bring in their expertise and ensure they're centering all the identities that a participant holds.
Right. And I can see how this would be a specific skill that would be necessary, also knowing that people come in on that spectrum of where the starting point is, because you said it's a group intervention. You have a group of people who are in front of you who are all entering with their own spaces. So this has been really great to have a conversation with you all. I want to thank both of you on behalf of the YJI and everybody in attendance today for taking the time to share this information with us. And before I get to closing announcements, I want to pass it back to you for some brief last thoughts.
Yeah, I think what we would want, we are hoping, it's Pride Month, but every month we hope that this conversation really motivates you and encourages you to center the needs of the LGBT young people in your systems and to figure out how to meet their needs, whether it's AFFIRM Youth, whether it's AFFIRM Caregiver, whether it is learning more. And we will certainly share with Alicia other links to sort of free options, as well as our paid training, so that you can sort of bring this knowledge and skills to your clients, so you can better meet their needs and really support them this month and every month. So thank you all for being here.
All right.
Thank you.
Great. Thank you both so much again. We're about to launch a poll question for our audience to ask how much you agree or disagree with the statements of this webinar was informative and this webinar was engaging. Please answer these questions so we know how today's webinar went for you. While everybody's answering that, I have a couple of points to put on people's radars. So immediately following this webinar, a survey should appear in the browser window that you used to join today's webinar. If you could please complete the survey, it allows you to provide feedback to us and questions. This information is also used to improve future webinar sessions. It should take no longer than 5 minutes, and we'll put a link to the survey in chat now. The YJI is taking a summer break from the Lunch and Learn series, but we will be back with more programming in September. If you are not yet a member of our listserv, please send us an email, check us out on our website, and we'll be sure to share that information with you moving forward. If you have not already done so, please feel free to connect with us on Facebook, Instagram, LinkedIn. These can be found on our website. And as a reminder, the views expressed here are those of the presenters and do not necessarily reflect the views of the New York State Youth Justice Institute. In closing, I want to once again thank you all for taking part in this session of the YGI Lunch and Learn series. We hope that you've gained something from this webinar today and that you'll continue to think about what Dr. Austin and Dr. Craig presented today. We look forward to seeing you at future YJI events.